We have had several patients in which the MEG has changed the surgical plan. A couple of examples that come to mind. One was a child who presented to the emergency room after a seizure and was found to have a left temporal brain tumor. In this case, it was very important to be able to map where the seizures could be coming from and its relationship to the eloquent areas in the brain in the dominant temporal lobe. We were able to localize where the epileptiform discharges were located, which were right posterior to the brain tumor, and superior to it, we were able to find the brain tumor had some auditory cortex. So this information was invaluable to the neurosurgeons when removing the brain tumor. I'm happy to say that this patient is doing quite well and thus far have intact hearing and understanding, which we're very happy for. Another patient that came to mind was a very interesting patient with a history of reading epilepsy. This second patient had an MEG and also was very invaluable in that we were able to localize an overlapping epileptogenic area right where the area in charge of comprehension was located. So in this case, this patient will have a responsive neurostimulator implanted to control their epilepsy.
We recently became aware of the incredible case of Virginia, a teenager with epilepsy. Virginia, who you have helped become seizure-free after successful brain surgery. This was achieved using a combination of methods and tools in your epilepsy program, of which MEG technology played a vital part. Please tell us why this case was particularly interesting from a medical perspective.
Virginia, yes, came to us and she was having seizures for a while. The MAG was very helpful in her case. So when we did a MAG scan on her, she had you will look at the picture and you will see that she has a large cluster of MAG dipoles in the right frontal lobe. And interestingly, we had looked at her MRI very carefully and we didn't see anything of significance in it. It looked normal. But when we got those dipoles, we went back and reviewed the MRI again. We thought that we were seeing some blurry margin in part of the gray matter there. And we were suspicious that there may be cortical dysplasia down there. So that's another feature of the MAG scan, that once it gives you the information, you can go back and always review, and what looks normal, you may be able to find an area which could be of interest for the seizure onset zone free.